Hi, my name is Jonathan David, and this is Nursing 312. My subject today is on nonsteroidal anti-inflammatory drugs and the musculoskeletal system. Nonsteroidal anti-inflammatory drugs inhibit prostaglandin synthesis and work as an anti-inflammatory, analgesic, antipyretic. They are also contraindicated during pregnancy and lactation due to probable adverse effects on mother and neonate. NSAIDs block two enzymes, which are cyclooxygenase 1 and cyclooxygenase 2. Unregulated COX-1 are found in all tissues and are all involved in body mechanisms, blood clotting, stomach lining protection, and maintains renal function. COX-2 unregulated are found at the site of trauma or injury only and not anywhere else within tissues. They generate inflammation, pain, vasodilation, and blocks platelet clumping. NSAIDs are absorbed by GI tract. Peak levels are from 1 to 3 hours and are metabolized in the liver and excreted within the urine. Effects of NSAIDs are decreased swelling, pain, inflammation, sodium retention, and decreases fever. Effects of NSAIDs inhibiting COX-2 reduces pain and inflammation. The use of NSAIDs is contraindicated and cautioned for patients with allergies to NSAIDs, salicylate, celecoxib, sulfonamides, and cardiovascular dysfunction, hypertension, peptic ulcers, history of or current GI bleeding, renal or hepatic dysfunction. NSAIDs' adverse effects on the GI are GI pain, constipation, diarrhea, and flatulence. NSAIDs' adverse effects on CNS are fatigue, headaches, somnolence, and dizziness. There are also many other additional adverse effects of NSAIDs, which are hypertension, platelet inhibition, bleeding, bone marrow, depression, rashes, mouth sores, dyspepsia, nausea, anaphylactic shock. NSAIDs drug interactions include potential to decrease effects of beta blockers when combined with loop diuretics. They may also produce lithium toxicity in conjunction with ibuprofen. Nursing management strategies and interventions are to determine pain and analgesics usage patterns, to obtain a complete health history including drug history and allergies, to assess for other factors causing inflammation or pain, to monitor vital signs, to educate patients about PO, PR, topical, or eye drop administration of NSAIDs, to teach patients about drug interactions, to monitor complete blood count, to educate patient on signs and symptoms of GI bleeding or hepatic toxicity, to instruct patients about urine output, edema, and flank pain. They are to also monitor for tinnitus, blurred vision, and other sensory changes as well. Cultural and alternative therapies. This portion suggests to not advise patients under 16 to receive this medication. It's not recommended for pregnant or breastfeeding women. It is also not recommended for asthma patients as well. Some other therapies that could be used are physiotherapy, acupuncture, cognitive behavioral therapy, and also other medications such as paracetamol, codeine, capsaicin cream, corticosteroids, TNF-alpha inhibitors, and disease-modifying anti-rheumatic drugs, which are DMARDs. The final solution or option would be surgery. such as in the knee or the hips or other joints. Research has shown that systemic review of randomized trials that include celecoxib, NSAIDs, or a placebo effect were collected through meta-analysis and involved arthritic patients. Celecoxib and NSAIDs were equal in efficacy outcomes, except celecoxib showed 46% lower incidence of adverse GI events than NSAIDs. There was also 71% lower incidence of endoscopy detected ulcers than NSAIDs. There was a 39% lower incidence of symptoms related to ulcers, bleeds, perforations, and obstructions. Celecoxib is equally effective to other NSAIDs in treating arthritis, but is incomparably more safer and tolerant in regards to the GI system. The use of NSAIDs with arthritis showed that there is a large variety of NSAIDs available to patients. It has been proven extremely effective in a short amount of time. Patients prefer NSAIDs dosing regimen and routine. Patients feel that the outcomes outweighs the probable side effects and adverse effects. Patients also favor the short half-life with low doses that equal less chances of toxicity. This handout is to be given to patients to explain to them what NSAIDs do, what their side effects are, and what drug interactions to watch out for. It also helps to know how long the medications work, how they're absorbed, and how they're excreted. And to always call their doctor if they have any questions or need any updates.
Did you press stop recording?
Stop share.